Food and waterborne illnesses, part 2. These are reportable diseases in Ontario. First, let's talk about food poisoning. Food poisoning is caused by toxin-producing bacteria, heavy metals, chemicals, parasites, fungi, and norovirus and rotavirus. Illness caused by these can be reported as food poisoning. It's transmitted via food or water and usually has a short incubation period, about 30 minutes to 24 hours. First, let's talk about Staphylococcus aureus, which is a gram-positive bacteria that produces enterotoxin. It can grow in dry, high salt, and a wide pH range. Most are resistant non-spore-forming bacteria and have a rapid onset of 1 to 7 hours. Symptoms of Staphylococcus intoxication are vomiting, diarrhea, abdominal cramping, which can lead to dehydration. Common sources of Staph aureus are in food that involve a lot of food handling, since Staphylococcus aureus is ubiquitous. Clostridium perfringens. This is the second leading cause of foodborne illness. It causes two forms of disease, the first one being common gastroenteritis, which produces mild cramps and watery diarrhea. And the second disease is pig belt disease. It's rare, but it can be fatal. Clostridium perfringens is a gram-positive spore-forming bacteria that produces toxins. It's cold tolerant, it can exist in soils, and again, it produces enterotoxins and spores. Common sources of Clostridium perfringens are from food cooked in large batches, food in institutional settings, meat, poultry, and gravy. Bacillus cereus produces two toxins, which can cause two different illnesses. The first illness being diarrheal Bacillus cereus infection, which is bacteria gets into our gut, then produces a toxin. And then emetic disease, which is the bacteria produces toxin on food, which is consumed. This causes vomiting and has a rapid onset as short as 30 minutes. Bacillus cereus can form spores and survive high temperatures. The toxin can't be destroyed with heat, as well as the spores. They can't be destroyed from heat. Common sources of emetic disease can come from starchy foods such as rice and pasta. Norovirus is the leading cause of foodborne illness and can be spread through food, water, can be spread person to person. And symptoms include a rapid onset of symptoms, usually 1 to 2 days, of explosive vomiting, watery diarrhea, and can lead to dehydration, but also has a quick recovery. The norovirus is very environmentally hardy. It can be transmitted via surfaces. It used to be called Calciviridae, but we renamed it to norovirus. It's a single-stranded RNA virus with no lipid envelope. Some sources of norovirus can be from contaminated water, ice, wreck water, surface water, and flood water. Salads are a common source of norovirus, as well as fruits, oysters. Secondary infection is a common source too. Ready-to-eat food handled by infected people is another common source. Rotavirus is a vaccine-preventable disease which can cause dehydration. It causes many deaths in children worldwide due to dehydration. It can be transmitted person to person. Rotavirus can survive on surfaces. Children, the elderly, and immunocompromised are at high risk of rotavirus infection. Human rotaviruses are environmentally stable and can survive a wide pH range, low temperatures, but it can be cooked at cooking temperatures. It's a double-stranded RNA virus. It has an incubation period less than 48 hours. Symptoms include watery diarrhea, vomiting, fever, and are self-limiting. And common sources of rotavirus infection are from improperly handled food, person-to-person transmission, and salads and fruits. So for food poisoning, a confirmed case is symptoms plus lab confirmation of toxin or other agents in the stool. A probable case is symptoms and an epidemiological link to a confirmed food or case. Some common clinical evidence for food poisoning, so common across all the previous pathogens I just mentioned, are vomiting, abdominal pain, malaise, fever, nausea, dizziness, headache, and diarrhea. If someone is experiencing food poisoning, it's important to exclude food handlers, healthcare providers, daycare staff, and attendees until they are 24 hours symptom-free or 48 hours after the completion of diarrheal medication is complete. So some things we have to do. So case management. If it's a seafood poisoning that we observe, we must notify the Ministry of Natural Resources and the CFIA. If there is a poisoning event, the Ontario Poison Centre can be consulted. If food agents are used as a bioterrorism agent, you can activate/coordinate the Provincial Emergency Operations Center. Some preventions for food poisoning are good hand hygiene, obtaining food from inspected and approved sources, preventing cross-contamination, avoiding temperature danger zone for food, cooking and reheating food to the appropriate cooking temperatures. Let's talk about listeriosis. It's caused by Listeria monocytogenes. It's a gram-positive bacteria and is the leading cause of death from foodborne illness. It is a facultative anaerobe and it is non-spore forming. It's a hardy bacteria that can survive salty environments and cold environments. Temperatures below 1 Celsius. It's notable for its persistence in food manufacturing environments. It's also ubiquitous and can be found in moist environments, soil, and decaying vegetables. Listeria can cause two types of listeriosis, or two types of diseases. The first one is gastroenteritis, which presents itself as mild to intense nausea, vomiting, aches, fevers, and sometimes diarrhea. It's self-limiting, but it can progress into the invasive form. The next type of disease is invasive listeriosis. It's an infection of the bloodstream and nervous system. It's deadly and can lead to death from meningitis or brain inflammations. Complications of listeriosis are endocarditis or heart infection, premature deliveries, abortions, stillbirth, or death through meningitis. Listeria transmission include foodborne transmission through ingestion of contaminated ready-to-eat foods such as deli meats, cheeses, or vegetables, cross-contamination environments such as manufacturing environments that have Listeria biofilms, and vertical transmission can occur from an infected mother to an unborn baby. Incubation of gastroenteritis, Listeria, is 2 to 3 days. Invasive is 2 to 3 weeks. Period of communicability. An infected person can shed in stool for several months. Mothers of newborns can shed via vaginal discharge 7 to 10 days after delivery. Susceptibility and resistance. So those most susceptible to listeriosis are fetuses and neonates, elderly, immunocompromised, and pregnant women. The reservoir of Listeria include soil, water, animals, and humans. For animals, specifically wild animals and fowl, the bacteria can thrive at refrigerated temperatures, and it's important to mention that asymptomatic fetal miscarriage is common. Some common sources of Listeria are ready-to-eat foods such as deli meats, cantaloupe, and vegetables, smoked fish as well. Unpasteurized dairy products such as soft cheeses, milk, ice cream, and chocolate milk. It can come from a manufacturing environment too, through workers, raw materials, and the processing environment itself. So a confirmed case is symptoms plus the isolation of Listeria. Probable cases are symptoms and an epilink to a lab-confirmed source. Some case management work we need to do or obtain info about travel history, food history, their occupation, if they're residing in an institution, collect lab samples for investigation, do food premise inspections, and activate FIORP if it's a multi-jurisdictional outbreak. Prevention. So to prevent listeriosis, it's important for high-risk or vulnerable people to avoid ready-to-eat meats, salted fish, soft cheeses, and unpasteurized products. Cook and reheat food thoroughly. Avoid raw milk. Wash fruits and vegetables before consuming. Prevent cross-contamination. Wash, clean, and sanitize food prep surfaces and our hands. Next, let's talk about shigellosis caused by Shigella. Shigella, the bacteria, is a gram-negative bacteria that does not form spores or move. Some produce toxins. It's important that Shigella doesn't survive pasteurization and cooking. It can survive and grow on foods with low pH as well. It can survive in vacuum food and in water. Here are some types of Shigella bacteria. Shigella sone, which is commonly found in developed countries and produces the mildest form of shigellosis. Shigella boydii produces mild but can also be severe. Shigella flexneri, it's commonly found in developing countries and can be mild and also severe as well. And lastly, Shigella dysentery. It causes the most severe form of disease. So the main symptom of shigellosis is bacillary dysentery or watery diarrhea and loose stools, but it can also produce nausea, diarrhea, fever, abdominal cramping. It can also be asymptomatic and it's also self-limiting. Complications occur from dehydration or death from dehydration. It can cause hemolytic uremic syndrome. It can also cause stillbirths. Transmission includes foodborne transmission through ingestion of contaminated food. It can survive on food for a long time, fly vectors, and cross-contamination. Direct contact transmission can also occur through sexual contact, anal oral sex specifically. Waterborne transmission can also occur from the ingestion of contaminated water. Incubation period of shigellosis can be 1 to 3 days, but it can be up to 1 week as well. And it's passed during the acute infection in feces and can last 4 weeks after illness. It can be communicable. Main reservoir is human, but it can be commonly found or sourced from improper food handling, salads, contaminated water, commonly found in homeless people, crowded and unsanitary conditions, and it's more common in warmer months. A confirmed case is symptoms and lab isolation of Shigella. Probable case is symptoms and an epidemiological link to a confirmed case or an asymptomatic case with lab confirmation. So some case management work we could do are getting travel history, food history, exposure to people with symptoms, their occupation, sexual history, household contacts. We can also educate about hand hygiene, advise them to avoid rec water, rehydration with electrolytes, and it's important to note that it is an antibiotic-resistant organism as well. It's important to exclude food handlers, healthcare workers, childcare workers, or attendees until a negative rectal swab 24 hours after symptoms or 48 hours after completing antibiotics. Some prevention we could do for Shigella when we travel is to avoid or treat drinking water, avoid untreated water, avoid food from questionable sources, eat cooked foods only, and fruits that you peeled yourself. For food safety, it's important to practice hand hygiene, avoid the temperature danger zone, wash fruits and vegetables with potable water, prevent cross-contamination, cook food thoroughly. For caregivers, it's important to follow proper diapering procedures, clean and sanitize diapering area, use of alcohol-based hand rubs, and ensure children wash their hands. For sexual contact, it's important to educate on safe sex regarding anal sex. For IPAC settings, contact precautions during illness should be followed. We should also promote hand hygiene and exclude food handlers, childcare workers and attendees, and healthcare workers. Next, let's talk about verotoxin-producing E. coli, or VTEC. E. coli is a gram-negative bacteria, and verotoxin causes hemolytic uremic syndrome, which is a reportable disease in Ontario. VTEC, or verotoxin E. coli, can also be known as Shigella toxin-producing E. coli, or STEC. E. coli is one of the predominant enteric species in the human gut and is part of our normal gut flora. E. coli can provide health benefits. It prevents overcolonization of pathogens in our gut. However, a small group of E. coli are pathogenic and cause disease in humans. There are 6 recognized pathogenic groups of E. coli: enterotoxigenic E. coli, enteropathogenic E. coli, enterohemorrhagic E. coli, enteroinvasive E. coli, enteroaggregative E. coli, and diffuse adherent E. coli. In Ontario, enterohemorrhagic E. coli, EHEC, are the reportable kind. EHEC is a group of E. coli that includes shigatoxin-producing E. coli, such as VTEC, verotoxin E. coli, the one I mentioned above, also known as STEC. It's important to note that E. coli 0157H7 is included in EHEC, so it is an enterohemorrhagic E. coli strain. Non-0157 E. coli can also produce shigatoxin too. Some symptoms of VTEC E. coli are bloody diarrhea with cramps, no fever, hemolytic uremic syndrome, and is often self-limiting. Complications, again, are hemolytic uremic syndrome. Incubation period is 2 to 10 days. Period of communicability is as long as the E. coli is in the stool, so 1 week or less. 3 weeks for children, and it's prolonged shedding is uncommon. Reservoir for E. coli are cattle and other animals such as sheep, pig, and goats. Humans as well. Transmission include fecal-oral transmission through the ingestion of contaminated food, contaminated ground beef, produce, and underpasteurized products. Waterborne transmission can occur through contaminated drinking water or rec waters. Animal-to-person or zoonotic transmission can come from petting zoos and farms. Person-to-person transmission can come from improper hygiene. A confirmed case is symptoms and the isolation of VTEC E. coli. Probable case is symptoms and an epilink to confirmed case, or hemolytic uremic syndrome diagnosed by a doctor. Detection of verotoxin or shigatoxin is also probable case as well. So case management, we want to obtain history of food, water, and other contact 10 days before symptoms, contact with other E. coli cases, their occupation, educate on hand hygiene, advise them to avoid rec water, and avoid antibiotics as well. We should exclude food handlers, healthcare workers, childcare workers, and attendees until 2 negative stool samples 24 hours apart. The medical officer of health can allow the return to work if they follow good personal hygiene. We can also exclude asymptomatic children, childcare providers, if they have positive samples. We should exclude them, rather, until they have 2 negative samples. Contacts should be instructed about transmission, hand hygiene precautions, and precautions about diapering. Prevention includes minimizing cross-contamination, practicing hand hygiene, cooking food thoroughly, treating or boiling water, regularly test water in private drinking systems, avoid unpasteurized products, wash fruits and vegetables with potable water. Yersiniosis, caused by Yersinia enterocolitica, is a gram-negative bacteria commonly associated with pork, especially pork intestines. It's a psychotrophic bacteria, meaning it grows well in low temperatures and can grow below 4 Celsius. That being said, it can withstand freezing and stay on frozen foods for an extended period of time. It's important to note that Yersinia enterocolitica is different from Yersinia pestis, which is the causative agent for plague. Yersinia enterocolitica is similar to Yersinia pseudotuberculosis. Pseudotuberculosis can infect via foods, whereas pestis infects via fleas and aerosols. Yersinia can survive in cold temperatures and persist longer on raw foods due to more nutrients being available, and it can grow. It's weak against acidic environments. Symptoms of Yersinia enterocolitica include fever and diarrhea, which are the main symptoms. It can present itself as pseudospendicitis through abdominal pain and tenderness. Yersinia pseudotuberculosis presents itself as fever, rash, gastroenteritis, and abdominal symptoms. Transmission includes foodborne transmission through contaminated food, specifically raw pork, meat, oysters, and fish. Zoonotic transmission can come from contact with animals such as puppies or kittens, and waterborne transmission through the ingestion of contaminated water. Incubation period is 3 to 7 days. Period of communicability. Secondary transmission is rare, but shedding can occur as long as 2 to 3 weeks if untreated. Reservoir for Yersinia enterocolitica include animals, soil, and water, and that being said, it can enter the food supply easily. It can also be found on swine, birds, frogs, fleas, and flies. Common sources are undercooked pork, vacuum-sealed meat, improperly handled food, unpasteurized milk, and contaminated water. Confirmed case is symptoms plus isolation of Yersinia, or in a probable case is symptoms and either a epi-link to a case or a NAT test. Case management, it's important to educate to prevent reinfection or secondary transmission. Exclusion should be food handlers, healthcare providers, and daycare staff and attendees until 24 hours symptom-free. So prevention is to ensure thorough cooking and safe food handling of meat, proper hand hygiene before and after handling pets or food, and avoid unpasteurized product. It's important to separate food prep and childcare.